Okay. Hi, Brian. Dr. Green.
Hello.
Hi, Dr. Green.
Hello.
Um,
I'm perfectly happy with Brian.
Okay.
how are you?
I'm good.
Good.
Dr. Green, where do you work? Well, Brian, where do you work these days? Are you in an actual office? Do you see patients and so on?
My office is in the Jamaica Plain VA, but I do house calls program, so I go all over Eastern Massachusetts. I still keep a few people in Somerville
Mhm.
that I do house calls on.
You literally make house calls to people?
Yeah.
Wow. To veterans or just in general?
Only to homebound veterans.
Uh-huh. Wow, that's very nice. Good.
It's neat.
Yeah.
And I manage a program that now has about 50 people in it that sees homebound veterans. Basically, we just finished hiring our expansion, so basically from the New Hampshire border to the Bourne Bridge.
Wow. Nice. Mm.
It is.
Hi, Robert.
Can you guys hear me?
Oh, hi, Paula. Yes.
Okay. I tried to chime in, but Brian was talking. I actually wanted to hear what you were saying, but I won't make you repeat it right now. Are you hiring nurses?
Yeah, USA Jobs. You can
I know I saw that.
go to USA Jobs. We just hired a bunch of people in expansion, but once you get to a program of about 50 people, there's always turnovers.
Yeah. Cool.
I'll wait till, oh, there it is. It's 6 o'clock. Gang's all here.
Mhm.
Call the meeting to order.
I second it.
Let's see. I had the agenda. When you, I'm looking at your screen, so when your things pop up, I keep trying to dismiss the things for just a minute.
Do you want me to read you the agenda or have you got it?
It'll come up in a second, but I assume the first
Okay.
item is what it always is, which is approval of the minutes from
That's
last.
correct, of the December 15th meeting.
So I make a motion to approve the minutes.
I second it.
All in favor?
Aye.
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 Oh, and then it's not in the agenda, but we have to do roll call, right? So yeah. So sorry to do this out of order, but Brian Green here.
Paul Machado here.
Robert Sixia here.
Okay. And item number 3 on the agenda is tobacco control.
Yes. Lisa, are you here yet? I can't see everyone that's here. Okay.
Mute. Okay. I am. I'm not going to turn my camera on because I am on hotel Wi-Fi through my phone, and so it might override the system I'm using. And if I cut out, that is why I will be back on.
Okay. Great.
Sorry about that.
It's okay. Well, we have an email that Karen has up on the screen that shows the the language that would be taken out of the Somerville environmental tobacco smoke-free workplace law in order to make it in line with the state, first of all, and would allow for the inhaling of substances at the safe consumption site.
So I'm sorry about this. I mean, maybe it's just me, but I feel like this is just one too many negatives for me to keep it steady in my brain. You know, it's the, if this is not the thing you didn't do yesterday, you should not do it again. I can't quite get it. So the top paragraph is what we currently define smoking as. And in that it says cigar, cigarette, pipe, other tobacco product. So any kind of thing possessing a lighted cigar or anything that possesses such a thing, like a cigarette holder that holds a cigarette, pipe, or other tobacco, or non-tobacco product designed to be combusted and inhaled. So what I read that as is basically saying, I mean, anything that's designed to inhale bananas or plastic or anything that you wanted to combust and inhale, right?
That's what I got out of that too.
For me, I'm not sure I understand the question.
I'm just trying to get at what our language says and then what we're changing it to.
Okay. Mm-hmm. Lisa,
then-
do you want?
Yeah,
So in
so what,
non-tobacco product
excuse me.
basically means that, I mean, it's specifically around things like vapes that have nicotine in them that I don't know how we're defining a tobacco product. Is a tobacco product something that comes from a plant that's made as tobacco, or is a tobacco product something that could be found in tobacco? So I thought we put non-tobacco products because secondhand smoke could include marijuana vapes or, I don't know, heroin vapes or whatever people might be making combustible or vaporizable that other people would be picking up secondhand. Right? And then,
Yes.
and then the state law is defining tobacco products, which is slightly separate than what we were defining as smoking. Am I right about that?
Yes, so I'd say this is Lisa. The state law is both broader and narrower than what you currently have, in that it focuses on tobacco products, which includes nicotine products, but is those tobacco products. But then it also encompasses vaporized or aerosol, so that's the electronic cigarettes, that type of product. So it both again it encompasses more, and then it also is more targeted onto tobacco products.
So if we adopt the state's legislation, it makes it broader in terms of also vaporization and aerosolization, which I thought we were trying to get at in our regulations. That's what the memory does. But then we lose the piece about non-tobacco products. That's right?
That would bring you in line with the state definition, yeah.
And to remind me, if we don't change it, what's the potential problem?
Isn't it the safe consumption site, right? That wouldn't be permissible under our regulations because it would violate if someone were to smoke, you know, whatever product, right, that's non-tobacco, it would be in violation of the secondhand workplace regulation. So they're looking to just use the state's definition to only prohibit tobacco products at the safe consumption. That's my understanding. So I think the modification would permit, you know, you can smoke anything else but tobacco products.
Right. Yes.
So I'm
Yeah.
so I'm pro. The piece there that I find worrisome is the anything. But
Yeah.
Mhm.
I mean, Brian, like my view of it is like, you know, with like regs, there's a whole ton of like context that's like missing, and you don't see like the preamble, all the definitions, the scope, any other like, you know, details in it. And like, you know, we could certainly go through that like broader exercise, but it would take some time to like kind of deep dive into it. You know, because the regs are just like a huge body of law. I think, you know, in my mind, and I know you're trying to like hopefully pinpoint on an issue that doesn't cascade into like some future policy issue or problem. I think my view of it is if we're copying the, the Association for Health Boards, you know, or I'm sorry, the state's language that, you know, the association supports, I think that's okay for me, you know, provided too that like, Bonnie, you've worked with the city council and or city solicitor to, you know, kind of cross-check this, doesn't affect any of our other regs or anything. So yeah, that's how I'm kind of viewing it, Brian, is like we don't have everything in front of us, you know, and we certainly can do that. It's within our like scope of work, but you know, kind of deferring to Bonnie and Karen and the city to like have like looked at that and considered, you know, these downstream effects. I think the policy goal is like one I support, you know, don't want to make a hazardous workplace that would violate secondhand smoking regs. So if that's the intent, I think that's good and would, you know, trust that the due diligence behind this has been done before coming to the board.
Yeah, I mean, at this point, I hopefully wasn't trying to advocate plus or minus. I was just trying to understand
Mhm.
the implications. I mean, I think we, as a board and as a community, are supportive of the safe consumption sites, and so I think trying to make that viable, and if we can allow these regulations to be updated to make that viable, I think that's appropriate. I just also, at the same time, have known that in the time that I've been doing that, large amount of money that's invested in keeping people addicted to nicotine goes into being very inventive and reading these more thoroughly than the rest of us to find loopholes. So
this is Lisa again, this would not increase people's exposure to nicotine in particular. So this would keep, as applied to tobacco products and nicotine products, would be stricter. It would be other non-tobacco products where there would be, and again, it would have to be, you know, open it up to everything, because to do other types of, like I know social consumption sites can become a concern. I don't know, you know, kind of how the health board, this Board of Health feels about it, but that's probably the area where this would come up. My understanding, and I am not an expert on cannabis law, but is that in order for a social consumption to be allowed, there's a lot of steps that would have to be gone through, and if that started to become a concern, you could revisit this if that was the issue. But that it has to be approved, and those regulations have to go through. And as I said, I'm not an expert, and I don't know. At this point, my understanding is that there really isn't a lot of guidance on what that process will even look like going forward. So you guys may be brought in on it in the future as well. I just, you know, we haven't been given a lot of guidance on what the social consumption site process will look like. This would mean that there wasn't a barrier for providing the safe consumption in terms of like non-tobacco product smoke exposure.
okay. And again, I don't want to harp on this point forever to move forward, but I think one of the things that we had talked about is trying to make the safe consumption site a safe place for the employees or the volunteers, the people who want to staff it. So the kind of dome or the ventilation or all of that stuff seems to be an issue that it's one thing to say safe consumption sites, you know, if people want to go, then they can smoke what they need to smoke in order to use safely. another thing to say that it's also going to be a safe workplace, which is part of our commitment. So but the part that I'm worried about taking away is not the ultimate control over all substances anybody could smoke. It's the trying to balance what the safe employee and the person who is going to be safer using on a safe consumption site as opposed to isolated and in a much more dangerous situation. But I don't think we're going to solve that in this particular bit of the legislation. I just think I want to be sure that what we're talking about is safe consumption sites and not whatever the bar down the street or whatever else opens up to take advantage of the next drug trend.
We can always, like the benefit that we have with our authority is we can always just close loopholes that, Bonnie finds or the city finds like pretty quickly. We can put our notice up and then close it down, right? We have pretty broad autonomy to, close these things out. And yeah, no, the other point on, I don't know what this, the smoking lounges, I forgot, I don't even know where that is on the cannabis, time frame. I know it was a part of the original law, but that was like 6 years ago. Yes, but it'll be tough to say. Hopefully people aren't like listening into this and like looking at these regs and finding out like there's a loophole, I'm going to take advantage of it. But if someone does that, or if we just uncover an incidental downstream thing, we can always just close it again. So yeah.
Paula, do you have questions?
No, I don't. I was no.
Okay. So I'll try and phrase this. I make a motion that we adopt the state regulation language regarding tobacco products.
I second it.
All right. All in favor?
Aye.
Unanimous. So carried.
Okay. Thank you.
Thank you.
Nothing else for us, Bonnie and Lisa?
I got to go to a dinner now, so have a good night, everyone.
And that was all it was on my agenda for now.
Okay.
So
Bonnie, always good to see you.
good to see you too. Okay, take care. I'll sign off then.
Take
Bye,
care.
everyone. Bye.
Bye.
Bye, Paula.
Bye.
All right. ISD is next.
Hello.
Hello.
Hi.
Matt Zano is with us as well.
Yep. Matt, are you here? And
Yes.
for the board's information, Nick and I work together a lot. We're both newish. He's not as new as I am, but new to the city and kind of figuring out how things get done, how public health work happens. And it's a little bit complicated here in Somerville, but it works. And we've been partnering, and now Matthew is recently in a new role, I think, as a deputy. So I just thought it would be a good opportunity for Nick and Matt to come and meet the board and just for tonight, say hello. And so that you know who they are and they know who you are, and introduce yourselves. And then if there are questions that either the board has or the folks from ISD have around how we work together, how we partner, how we could partner, feel free to raise those, but there's really no set agenda here. It's just for us to all meet. So Nick, do you want to introduce yourself and Matt and the team over there kind of in general terms?
Sure. Hi, board. Thank you, Karen. I'm Nick Antanovic. I'm the director of ISD. I think I met a previous version of the board. I'm not sure if you're all the same members a couple years ago, prior to the pandemic. And then things kind of fell off, and I was not going to your meetings. We had other stuff going on through those years, and now we've brought on a new deputy, Matt Zano, and now that we have a new health director, we're just here to get things going again and get back up to speed with how everything should be working.
Yeah, just to say hi, Matt Zano. As Nick said and Karen said, I'm the new deputy director. I was previously the ISD paralegal for ISD. I did do health stuff, and I was mostly focused on building stuff, but a lot of code enforcement stuff for the city for the last 8 years. But I did a lot of interfacing between the law department and ISD. But I look forward to working with the board more in my new capacity.
Should we?
Yeah. So my question, I was going to say. So my question is, do you have any questions for us? I know that there hasn't been much interaction between this board and ISD over the last several years, and considering we have the enforcement inspectors and a lot of other stuff that go along with the Board of Health, just wondering if you all might have any questions.
Well, I'll start. So I don't know since you don't remember who was on the board before. I'm Brian Green. I'm the chair, and I'm a physician. I have a small practice in Somerville because, as I was saying, I do house calls. I run a program that does house calls on the eastern side of Massachusetts. And I've been on the board for a while now. I stopped counting for a decade. But I've been here through pre-COVID and various tobacco legislations and a few different versions of fats, oils, and grease, and a lot of rats. So
Always rats.
oh yeah, indeed.
I'm Robert Sixia, board member. Although I started now, I still keep track. Going on year 7. So my day job, I'm the general counsel of a small state agency that collects healthcare data in the Commonwealth. Yeah, primarily kind of have like a legal lens here, and I have an MPH, so a bit of a public health background as well. Nick, actually, I remember meeting you, and I think the board, yeah, we've been the same since I've been here. So, but yeah, that feels like a world ago. Yeah, I think.
I think it was prior to COVID, right, or just before that.
Yeah,
and then
2019-ish. It's good to meet you again, Matt. Great to meet you for the first time, I think. I think, the only kind of major question that kind of comes up, and, we can talk about an hour after Paul introduces herself, is, and I think as I've kind of reflected back on my tenure here as a board member, the meetings I was first starting out with were very heavy with ISD, and in particular, non-compliance with the health code for restaurants, where, we were, I think, typically like, brought in at the very end after like warnings, notices, all remediation had been exhausted, and we were now moving towards like, a more punitive, form of compliance, typically with, closures, a week or 2 or longer. We do that a few times. We've done it with Bonnie for tobacco, but I think, I distinctly remember COVID, and then like that all just completely tailed off, I think, understandably. So I think, just maybe talking to you about like, that kind of, change in what had typically come before the board with restaurant violations. If, that was one due to COVID and priorities just shifting within ISD to, obviously more, present matters, or if this means compliance is improved, or maybe it's something else. So yeah, that's really the only thing I'd have in mind to kind of chat through with you if we have you on.
Is there somebody else, or would you like me to answer?
I was just gonna introduce
Okay.
myself. My name's Paula Machado. I have to figure out this video one of these days. I've been on the board since 2007. I'm an oncology nurse, and yeah, I think you've been on a few years before me, Brian.
Not very many, but I think one or two.
Yeah. So I think we've met before too.
All right, well, thank you. It's nice getting to meet you all again. To start right off on the question about restaurants, so there have been several changes that have occurred. One of the biggest changes is that we have a contract food inspector now, Mojin Solutions. She was previously, or the company was previously with the city about 8 years ago, I believe, to come in and help train some of the new restaurant inspectors that we had. And just prior to COVID hitting, we lost one of our restaurant inspectors. She moved away to a different city. And then right when, just before COVID hit, we lost our second restaurant inspector to another position. I believe he went and started working for Legal Seafood as their compliance officer. So at that point, we brought in Mojin, and that has actually helped in the efficiency with getting the restaurant inspections done and up to speed. Just using the contractor, we've been able to have more staff and be more aggressive with how we're doing the inspections. Before, we weren't able to get to the minimum of the 2 to each restaurant yearly. We were barely getting to 1 to all the restaurants in the city. Having the contractor on board now, we are above and beyond all of our required expectations. We have continued follow-up. And yes, we have had an increase in compliance.
There was, and for all of you, Karen, you might be interested, there was a while where when we would come into the team meetings, we would have a list of the 10 restaurants that were investigated this month, or the ones that had significant findings, just as an experiment to sort of see the kinds of things that were going on in Somerville and what we needed to be aware of. And I think we never changed our behavior dramatically based on that, but it was sort of interesting to keep tabs on how things were going. And I think we had a discussion recently about a new, I can't remember the artful term here, but a cold therapeutic, cryotherapy.
Yes.
And when we were trying to figure out what the requirements around that were, we were thinking back to when the float tank business started in Somerville. And one of the questions was really, how are we going to make regulations around what kind of investigations they needed? And it depended on what the capacity of ISD was to go out and do those investigations, right? Same issue with when we had our first round of regulations around body art. There was a sort of a balance between what allowed the establishment to function and what allowed the ISD department to be able to, in good faith, do the kinds of investigations that we did. So it's for us, it's really helpful to know what ISD has the capacity to do and what's around the kinds of investigations.
Someone
doesn't make any sense for us to say you need to go and evaluate the float tank establishment every week if A, there's no health reason to do so, but B, you don't have the staff.
We're
No,
getting some background noise from someone. I'm not sure who it is. So if you're not speaking and you want to mute, or if you're not in a quiet spot, go ahead and mute. Thank you. Nick, go ahead. We were going to answer, and then I had some thoughts to share too on this.
So yes, and actually going through and reading some of the ordinances, I believe the paper you were talking about, or the spreadsheet, is actually a report that we are supposed to be submitting to the Board of Health on a regular basis. There's been a lot of catch up and cleanup from what we've been going through in our processes. So that is something that we want to start again, is giving you a monthly report of all the investigations or complaints that we receive from the restaurants in those areas. We are actively trying to staff up and bring in and train up our staff in order to do that. Like I said, we do have the contract restaurant inspectors, but as far as the other inspections regarding housing or short-term rentals or other health issues, we do have a series of inspectors that are, like I said, we're working on getting trained on all the different aspects. We have had a couple of trainings on the new sanitary code that is going to be coming into play in April. All of the health inspectors have OSHA 30 cards at this point as well, just for construction and health safety in the workplace. And then they also, all of the health inspectors have also achieved their ServSafe certificates.
Fantastic. I just wanted to add, you know, since I've started, Nick and I and his team have worked on a number of issues as they come up, and it might be exposure control if needles are found that his staff or DPW are involved in picking them up, and some other health and safety issues for employees that we've started looking at together. Nick has also, or his team has showed us the whole Citizen Serve software system that we have access to as a health department, but our staff had kind of not, a lot of us didn't have a login. So we're set up with some of these capacity things we've been working on, and we appreciate the support of ISD to get us onto Citizen Serve. Some of the staff have been over and trained at length with Nick's team so that we can run these reports. And for example, the exposure control committee that's meeting with police, fire, and public health to develop exposure control plans for the city and training that's needed, went through and did some reports around from Citizen Serve on types of complaints or bloodborne or calls to do with that or cleanup. So there's a number of ways that I think we can use this data and report back to the board in a more regular way. I think we're kind of finding our feet. We all just got onto Citizen Serve, and Nick is staffing up, but I think that's something we can talk about more, especially in light of maybe some goals we set, that Citizen Serve and inspectional stuff may be part of goals or target areas that we want to, you know, to address. So we're very excited to partner, and it's really helpful for our team to have all of the work that's going on over in ISD and this partnership with Colin and the rodent situation as well. So the environmental health stuff, these things are all really intertwined. And, you know, there's really a lot of ways. And again, recently, Nick and his team have put a lot of time into the Regional Public Health Excellence Grant that we're a part of. Cambridge has recently joined our group, ourselves in Arlington. And it's a capacity assessment of our public health, like which core functions from the state law that we're required to do, are we doing them? Are we doing them to the extent that we want to be doing them? And where are the gaps? And so we're at this stage where we've been collecting lots of information from, most of it from ISD, because they perform most of these sort of regulatory functions for public health. But it's helpful for us to see how other towns are doing it, and then how we can build on it, what the needs of Nick and his team or the food inspector, or where we might take the housing inspections to another level to address childhood asthma or, other public health issues within housing. So there's lots of ways that we look forward to partnering with ISD and kind of as we move forward. And a lot of times it's just problem resolution as things come up in the city. Nick and I were on a call earlier. So often we get looped into public health, DPW, citywide issues that might be one-off or might be part of larger problems that we need a sort of comprehensive solutions to. And yeah, I talked about housing control. So I think those are some of the main things. And as we get more used to Citizen Serve, we'll be looking at some reports that might be useful to the board, just so you understand the level of, what is all the work that is happening on the inspectional side and where there may be more support needed. And again, budget time. If there are things that our public health inspectors feel like they need support, we would want to support them as a health department as well. So those are just a few of the ways that we're partnering, and we appreciate the partnership. Yeah, I feel like we talk all the time about all kinds of things. But
Well,
are
great to-
there any other? Yeah.
No, I don't have any other questions. Just great to hear about the collaboration. And Karen, you come from another health department, so granted, probably with a little different priorities in Somerville, but another perspective that I'm sure you're bringing in that, we could probably use. So yeah, no, excited to hear about your thoughts, your vision. And Nick, great to see you again. And Matt, great to meet you. But I don't have anything else. So.
Actually, just two more things, quick ones, since we're updating. There's so much stuff that I got sidetracked with just the restaurant. So we do rodents as well, as you all know. We did expand our smart box program. We added 25% more boxes through the new contract. We extended it for the year. So now we're deploying those into different areas. We actually did our redeployment about a month and a half ago. So now we're looking at a couple of different things. Obviously, this is a downtime in the rodent season, but we're obviously getting geared up for the fall. We're getting ready to send out our mailers in March so that we can get people ready for April. And we're also looking at a couple of new technologies for rodent capture that we can, add to our toolbox of tricks that we're using right now. I don't know. I keep getting more reports about dead rats. I think that's a good thing. Some people might not, but if they're dying, I think that we're doing our job. And one other thing is that we have stopped baiting the sewers. The reason why we have stopped baiting the sewers is the DEP told us that they didn't want us putting poison in the sewers anymore. And two, it was, in my opinion, and watching for the year that we were doing it in the sewers, it was mostly window dressing. You'd hang a piece from the sewer, and then if we had a rainstorm or something else, it disappeared. We don't know who's eating it. We don't know where it goes. It was window dressing for the most part. So we were able to use those funds and allocate them for the SMART program and some of these other new pilots that we're going to be looking at in the next year. But I did want to say that because I know that there's a question of whether or not the sewers are still being baited, and I want to be clear that we are not baiting the sewers. It's just it wasn't worth the money, and it wasn't environmentally clean with what we were doing. So we decided to stop that. And then just to bring up one of your other things is fog. So we do have a new fog program this year that was required by the DEP as well. We are in the first year of basically making everybody aware that we have fog requirements and what the expectation is on their licenses moving forward. And then during this next renewal cycle, when the letters go out in April, June, they will be required to provide the required fog documentation in order to obtain their license renewal. What we are looking for on the fog documentation We've boiled it down to basically 3 bullet points. We want to know who's picking it up, how big is your container, and how much are you sending out. And we just need,
Sorry,
we
you
need
gotta remind me what fog is again.
I was gonna say,
Fat-
for the people who
fats,
don't know
oils, and grease.
the acronym. Yes, fats, oils, and grease.
Okay, all right, thank you.
So yes, it's all the stuff that we don't want going into our sewer systems. They're supposed to be containing it and pumping it out to a licensed disposal place. So that's what that's part of the new fog program now, is that you just have to show us that you're doing it. For the most part, any new restaurant from 2010 on, I believe, was required to have fog stuff under the new building code and all the other things. So we're not worried about really any new construction or renovations that have happened. That is them literally just submitting the paperwork. They have all of the stuff. We're anticipating we may come across a handful of older establishments that may not have the required systems under the fog code. So we'll be working with them to bring it up to par. There is also a section under the fog, I believe, where if they are unable to comply, they have the potential to come to the board for a variance.
That's consistent with my recollection too, Nick.
No. That is actually, that's one other thing that we also were looking to clean up as well, was the variance process. We have a defined variance process with the zoning board. We have a planning process with the planning board. Right now, we know that variances are permitted by the Board of Health with the request, but we don't have a formal, hey, you apply here, this application goes here, and it goes out for everybody to track. So we're going to be working on setting up just the standard variance process as well.
Yeah, and Nick, on variance, honestly, the only thing I would look towards if something came before us is, obviously your team does an assessment, a review, but just kind of consistency and fairness and equity across, like, when variances are proposed and, brought up. At least that's what I view on my lens. So as you develop a rubric for it, just as long as it's consistent, fair, and equitable. So.
I'm a big fan of consistency. I chant that all day long. In ISD, we are usually giving people bad news. So I always tell the staff, everybody's gonna complain and swear about us, but they're gonna do it for the same reason. So.
That's right.
I mean, I think with the variances, I do worry sometimes that we meet the third Thursday of the month, so sometimes it moves a little up and down depending on when the month starts with a Thursday, and so if somebody applies for a sushi restaurant and they happen to do it on the third Friday of the month, then it may be a while before it comes around for us to consider that variance, and sometimes it happens in the summer and we take a month off or something. So I always feel like stuff that's procedural like that, we should be consistent, and people should know when they're applying for things with the city that we can turn around in a way that's fair. So anyway, this is more of a tobacco thing, but there are times where a tobacco selling establishment runs afoul of the rules, and then they have to come to us, and sometimes and then we assess that they cannot sell tobacco for 5 days or 10 days starting after the meeting time, but sometimes that's tomorrow and sometimes that's 27 days from now, and I always think it doesn't quite make sense that we caught you selling tobacco to a 15-year-old, and so 27 days from now you're going to have to be in trouble. I don't know that there's a way to fix that exactly, but the more we can make these things as consistent as possible, the better.
Absolutely, and typically when we're doing plan reviews, we try and let every applicant know as early as possible if there's something that either should be revised or is going to need some type of relief, whether it be from the health code, the building code, the zoning code, or any place. Typically, for the most part, we haven't gotten any variance requests from the health code. We have gotten several HACCP plans, but we haven't been in a position where anybody's requested a variance from any of the code items.
Paul, I always want to check in with you because you're not on screen
I know. Oh, my,
or online.
can you hear me now?
Yeah.
Oh, okay. I said that list you were talking about is the list of restaurants that would have, like at the beginning, we used to get that big pamphlet. Is that what you're talking about?
There were times when we would come in, there would be a list of the restaurants that had findings.
Yeah, is that what you were talking about when you requested it?
Well, that's what I was
No.
talking about earlier in the conversation.
Yeah, that's what I'm asking. Okay. I don't have anything really to add.
Okay, well, if that's everything from you all, again, this was a great introduction. I'm glad to get back, and hopefully we can do this a little bit more regularly, and we'll start getting our stuff together to get you some more information. And maybe next time we meet, we'll have a cryotherapy business to talk about.
All right.
Thank you, Matt and Nick, for joining us.
Yeah, thank you.
Everybody.
Thank you.
So Karen, I don't think this is a ISD thing exactly, but another, just of interest, another one of the reports that we used to get pretty regularly that definitely got shoved aside by COVID was that we would get 911 calls for opiate overdoses and other overdoses and deaths too. And it was, I think, just one of the things as a city that we were tracking, and it's clearly still an issue and still an important. So in terms of the things that we should be getting regular reports as a board, that seems like one of those things that for Somerville is clearly something we should be.
Okay, yeah, great.
And I would think it's on the higher end right now. No.
The last time I checked, which was in December, the Somerville rates for fatal overdoses had not increased a lot as of this year, but the state is quite a bit behind in its reporting.
Yeah.
And we definitely have challenges. In fact, we had a meeting, I don't know, yesterday or today with the mayor and public safety around data collection for exactly these things for our harm reduction efforts. So we have an understanding of where our base level starting point is. And there are some coding discrepancies. So I think when the calls come into dispatch or maybe the police officer responding codes the call, they're not always consistent in how it's coded. So they have a new data staff member who is working on trying to get some data consistency there. But we can certainly provide the state's data that's a little bit behind until we get some more, some cleaned up reports from them. But I will ask that again. I think that that's a great idea. One of the things we're working on internally, and I'll talk about this in a minute, moving forward, is a regular report that's a little more numbers based for the board as well as other stakeholders, so that, and will also be used to track us against our goals and our budgets, so that they're all intertwined. And that's kind of the next phase for me that I was about to talk about, is that we are reviewing our progress against our goals and our budget asks, and certainly other key public health initiatives like overdoses that you just raised. So that's where I want us to be thoughtful. I don't want you guys to be handed hundreds of pages of citizens serve reports of everything. It's a ton of information that goes on. So I think that this will be a good exercise for us over the coming months to set some goals, think about budget, and then also think about what data is going to be important for all of us to look at monthly around tracking these things. The city has recently set up, and this is a nice segue. Do you want me to start my report, or?
Yeah, it's our Health and Human Services update is the next thing, so have at it.
Okay, thank you. So I was going to talk about, I'll give you a quick my first 6 months sort of update on some things that we've accomplished as a department. And then moving forward, the city has set up a template that I will probably share next meeting. All the city departments are putting their goals in, including the mayor's office, and Somerset has set it up. It's fantastic, and you can indicate where, if you're partway through meeting that goal, it gives you an opportunity to put progress, any roadblocks, and then sort of a date and time. So it's a real working document, but a really nice quick way to see. We said we were going to, hire so many people. How have we done? We've hired, X. And it gives you a percent complete of the goal as well. So again, that will be linked to some of the data that we're reviewing and looking at. And that's our regional grant. Everyone in the team is kind of reviewing both the CHA needs assessment report that came out, and then other targeted information and sort of areas of focus for the department. And again, linked to our budget ask in the spring. So this is where I hope we move to over the next few months. And when we come back in February, I'd like to bring a draft of a first sort of data monthly report for you guys. And I took some notes about the things you said, and then we can revisit it together to see what more, what other things make sense to have reported on a regular basis. So thank you for bringing that up. So in the first 6 months, one of the things that I was asked to do was incorporate several new positions, one being a deputy director, and dividing the department into human services and public health. Those are kind of broadly the categories we call them, while there's tons of overlap. But I think it's been really helpful for the department to have this structure in place. And as you met last time, you met Kelly Highland, the public health director, deputy director, and Nancy Bocci's on the human services side, gives them both an opportunity to really focus and build their teams. They both have lots of hiring. So if I can, I'm going to try to quickly, I'm trying to share my screen again. Just need to exit out of this. So one of the other major accomplishments of the first 6 months, I think, is kind of this, what I call loosely a reorganization, or putting all of the new positions into, I don't know how to do this, exit out. Putting the new positions into our organizational chart, and then hiring. So we have been busy with our hiring. Webcam, hold on, I'm just going to see if I can do this. Any ideas how I exit out of the full screen, anybody?
On the top right.
Yeah, I've got nothing up there, Paula, just X's on each of you, so I'm afraid I'll X you out.
So above there's that little horizontal bar where your mouse is now. If you go up, keep going up to above the star.
I don't see a star.
Right above where your mouse is. Oh, that's my mouse. Yeah, where your mouse is.
Yeah.
There's a star right above you.
That?
Now you've gone
Stop
off.
sharing, Brian.
You went off the screen.
That's funny. I'm not seeing a star on mine.
You see the K?
What?
You see the circle K? The K in the circle?
I think Brian's just saying if you can minimize it. Yeah. If you just go to the top right There's keep going further up beyond your browser. Yeah, there you were just
You can
there.
X out the browser if you want to do that, but I was just going to minimize your browser.
I mean, this is fine too.
Yeah, I don't know how to minimize the whole browser. We're sort of,
So I think if in this Windows system you're in, whatever's behind your screen, you're sharing your whole screen, I think.
oh, okay.
So
But I can't get to the PowerPoint app. Are you seeing a PowerPoint of the organization? No. Click to stop sharing.
you do that.
Yeah, I just don't know how to minimize all of view. Feel like it should be in this view, attendee view.
But we're not, what you're seeing, I think if this is like Teams, I don't use GoTo, but if this is like Teams, what you're doing now is sharing the screen, your desktop.
Yes.
Because we were seeing when you moved your Outlook onto the desktop, we were seeing that. So right now, whatever you want is behind this.
Right, which I can't get behind. There's nowhere to,
Right
okay,
where your mouse just is.
right there.
Okay. Move up slowly. Keep going. Keep going. Keep going. Keep going. Stop.
Oh, shut off.
I don't know. Okay. There's
Oh.
nothing, it's just,
Yeah.
It was
So
just there.
you're right, that horizontal line above
Here?
that
Next
star.
over.
Email to us too, Karen, later for us to view and just give us a verbal presentation of it.
yeah, I'm gonna have to do that.
Okay.
Sorry, gang. Okay, so there is an org chart that we created, and at the start of the fall or around midsummer, we had 17 vacancies, and they were all in red. We're now down to six vacancies. So we recently, our most recent appointment was the LGBTQ plus coordinator, Izzy Starr, and we currently have the remaining 6 positions are still have just gone up, the 2 youth ones. So the youth director, which is new, very exciting, and the youth coordinator is an existing position, but is vacant at the moment. So those ones are up. The mental health services coordinator, which is also a new full-time position, is posted at the moment. So still a lot of work on the hiring front, but a lot of progress made. The youth position is new for this city. It's very exciting, involves obviously lots of departments, lots of input. So that one took a little bit longer to get through the process, but we're excited that it is posted and there's been good interest in just a couple of days. So the hiring has been a really big part of the first 6 months, but the team is fantastic and we're making good progress there. One of the other sort of aims of my 6 months was to begin to bring the group together as a team. So our leadership team meets monthly. We are deciding together as a group how we want to structure that time, what we need to get out of it, what kind of trainings and learning the leadership team needs, and then what the overall staff need. And then we're moving towards quarterly all staff meetings. So we had our first one back in late November, which was a huge success and a lot of fun. We'll begin to think about a springtime all staff, really challenging because again, it's 45 people and where do you put them and where do you park? But we'll figure it out. And I think it's really good for the group to begin to get to know each other and then see some ways in which we can support each other's work. Public health nursing might go on a home visit, or so many ways in which we can be combining our efforts to improve services to the community. And then professional development, we had 5 staff attend a national conference here in Boston, the APHA. We had several others going to MHOA. I'm a big believer in professional development and want to support staff in memberships and dues to professional organizations and also to attending conferences where it's appropriate and building skill base. That's been well received. I'm excited about the progress there. Again, I met with approximately 25 different agencies in the community that were sort of key stakeholders that some of you flagged, or the administration, the team. So they're, pretty much all the major nonprofit players that you can imagine. I know that there are hundreds to meet, but the first 6 months of catching up with these 25 key stakeholders has been a huge learning curve for me and enormously valuable. We've identified some gaps in our COVID and respiratory response. So we've been collecting a lot of data around COVID, but expanding that data collection, and the dashboard that Somerset produces now includes respiratory flu as well as admissions, wastewater, and COVID, so that we're getting a little clearer picture of the pressure on our hospitals, schools, what's happening in the community with all these key indicators, and then identifying gaps. So looking at where our vaccine rates are still low, where we're seeing spikes in hospitalization, what age group, and targeting communications, outreach, and clinics. We are also expanding, and we've done a lot of preliminary work in the harm reduction services. We've done a lot of laying the groundwork, working with the feasibility study for a supervised consumption site, other affiliated harm reduction services that would go with that, thinking about how we might evaluate our harm reduction programs. So needle collection, that raises, everything you do kind of opens up a can of worms of lots of other issues around who is collecting needles in the city. Are they doing it safely? Do we want multiple collection sites, or do we want it more centralized so we can keep track of the data? So these are things that the city, and it's been fantastic we've found that there's pockets of NICS staff and DPW, police and fire who are doing this work, or they have some exposure. Some of them might have a policy, others don't. So next week, we're coming together as a citywide health and safety committee to really formalize these things and assess what else we need. It also lays the groundwork for collecting data and understanding the size of the issues, especially around harm reduction services. We were able to get the access contract back in place. They have now been coming to Somerville, doing outreach for about a month now. And once a week they come, and they're also connected now to the new engagement center for the homeless, that they're going there with supplies as a sort of secondary provider of Narcan and needles, whatever else is needed. And we're excited about that relationship that Matt in our prevention unit has been able to foster and begin to grow. So it's just working on how to expand services for some of our most vulnerable residents. We re-engaged the MRC last week, had an initial training and information session for MRC interested in supporting the needs of persons experiencing homelessness. There were about 20 attendees. It was fantastic. Good to know that that interest and support is there in the community when we are ready to activate them or utilize them for whatever needs might come up. And then again, the capacity building work that we are doing on a regional level is also something that I think moved a long way in the first 6 months, and is a really logical place to start, because it forced us and the 3 other health departments in our region to go through the original requirements of the Mass General Law and public health, and and for me being new, it's been fantastic to figure out who in the city is doing which parts of the requirements. And Somerville is unique in that there are many players helping to meet all of our public health requirements and needs. So it's a good thing. It's been a way to get to know a lot of the other departments. We've also found some gaps, which you would expect, and Nick is fantastic. Some of them you already knew about, and we'll work to fill those and make sure that we're in compliance with the state. And we're doing it on a regional level. So we may not need a fog inspector for just Somerville, but we might need a regional fog inspector to help make sure all 3 towns are in compliance. And that's certainly where the Department of Public Health is really encouraging us to grow and to improve services through regional work. So we're excited about that relationship that's beginning to happen. So a lot happened in 6 months. The team is fantastic and the support of the board is amazing. So I look forward to kind of the next 6 months of having a little more formality to our goals, our data, our review of our progress each month and each quarter with you. Any questions or things you want to talk about more?
No, I think just good to hear on your progress. I imagine you're just in that stage of getting comfortable with the job and the place and building a team and, you know, building capital and I guess, you know, moving towards now like a vision, which, yeah, I think that would be the, you know, what I'm excited to kind of hear from you. You know, I think like we're generally just supportive of the health director and want to endorse creative and innovative, forward-thinking solutions. I try not to drive too much policy here. I just try to like support as much as I can that comes out of, you know, your team. So yeah, great to hear that, you know, bit by bit, settling in and figuring stuff out.
Yeah, good. One other quick update for the board to do with the department and our board structure. We talked about the reappointment process that's underway citywide, and I spoke with the IGA Intergovernmental Affairs. They are proposing that we go ahead and post 2 of the 3 positions sooner rather than later as part of this process citywide. Again, thanking you guys so much for all that you have done for serving on the board. And if people are interested and eligible, they can certainly reapply. What they have proposed, which I think makes sense, is that we start with not, even though all 3 of your roles, your terms have expired, that we don't fill them all at once, that we leave the chair in place for some continuity, and we start with the 2 other positions, fill those. That process, I'm told, takes about 6 months between getting the requirements for what's needed for a board member that has to get posted and translated. Then it will be left open for 4 weeks or so, and then there's a committee, a citywide committee for all boards and commissions that interviews interested members. Then they make recommendations of a couple of candidates to the mayor, who finalizes the recommendation. That goes to the council, then it gets approved. So who knew, right? There was this many steps to it, but what Hannah said today is that generally takes about 6 months for the process. So we would recommend that we go through the process with 2 members, but not all 3 initially. And then when we have those filled, we can go and look for the 3rd, start with the 3rd position. Does that make sense to everyone? And any questions?
Yeah, just so I can make sure I heard this. So this is all 3 board positions will be posted for, and you know, we basically, it sounds like, are we reapplying then, assuming that like we're interested in continuing to serve, and then okay, we would, you know, put our names in and then just go through a process, right?
Yes, that's correct. And what they said was there will be like a posting on the website, but there'll be a press release and it will come out to all of you and to me that a position is posted for the Board of Health, or whatever these committees are, and who to email. It's a city, this committee that's going to meet twice a month, that does meet twice a month, and they will list any vacancies or postings for any boards and commissions like at the moment. And I guess they're getting quite full because I think we're not unique in that during COVID and what have you, there were a lot of boards and commissions whose terms expired and whatnot. So I think they're busy, and there's a lot of boards and commissions and spots that have to go through this process with us.
Yep. Okay.
Yeah. So I will let you know. I think some of you may know of folks who are interested. We can certainly pass it along, but I think basically it will be posted. There'll be a press release, and hopefully interested members of the community will see that and can, reach out to whatever that contact address is.
Okay.
So I'm not concerned, but I guess I would just say that past precedent, as I understand it, is that when members of a board were appointed, then if they reappointed, they didn't have to reapply. If everybody is reapplying for positions, then it brings up the question: are those competitive? Like if I reapplied for the position that I have and there are 20 applicants, am I in a competitive setting, which is fine. And there's another reason why we're in this fix, because the appointments have expired.
Yes, and what she said was, you're exactly right, that if it for 2 terms, for up to 2 terms, I don't know if it's just the Board of Health members or all members, they can just kind of reapply. It's sort of more automatic process, like you said. So, but if after 2 terms, Hannah said, then it's open to the public to, it's like a full normal process of like starting over. Whereas I think if you are a member of a commission and you want to just be reappointed for up to 2 terms, you can be. But what she's saying is you're all beyond the 2 terms where it has to go to a public call. Does that make sense?
Sure.
So there's potential, obviously, other candidates will get appointed versus us. So, in short end of it.
Yes, I guess that's a potential. Yes, people are interested in.
And who makes that decision?
So first it goes, anyone interested is interviewed. There's a half-hour interview for anyone who meets the criteria. So this is what I'm told. So anyone who applies who meets the eligibility will be given an interview for 30 minutes with a committee called AAC. And to be honest, I didn't ask her what it stands for. I think it's called must be Appointments and Advisory Committee. I don't know. I don't want to make that up. It's a committee that is put together that is charged with filling vacancies for all boards and commissions within the city. And I know that they were looking for one more staff member, who I believe is now the director of Somerset, is going to be on the committee, but I don't know who makes up the committee. So there is this committee. They meet twice a month. They do the initial interviews. They make some recommendations to the mayor. And I think she said they'd like to give like 2 recommendations per spot to the mayor for positions, and then the mayor can make a decision from there and makes a recommendation to the city council, who have to vote and approve it. It's a long process.
Okay.
Are you a part of that process, Karen, or is this just kind of like isolated with this independent body?
I am part of this committee's. I will be there for, I believe, the interviews. I don't know that she said, the way she said it was, I am there for the sort of subject matter kind of questions in that. But I don't know that I can actually make a vote. I don't know if I'm a voting, I can ask that. I was actually thinking that too. If I'm part of that process that decides after the interviews who goes forward, or if I'm just there as, a health person to help write questions, interpret answers, not sure.
Sure.
I will
think,
ask for next
yeah,
time.
like I'd be interested in serving, granted, if there's mutual interest, in to reapply would certainly not want to go through this if, you know, just not something that the city's interested in. But, you know, assuming there's interest in a reapplication, I'm fine doing that. I think just shoot us the press release or the you know, application. I guess, you know, our 2 seats are first and then Brian's seats is next. So, because I don't typically monitor the press releases that kind of come out. And
Yeah, no, right.
not on the
I'll
city's job board too often. So yeah, if you don't mind just sending it over, I'd be interested in reapplying. So
Yes, okay. And then again, you can check with them on the eligibility piece.
okay.
Yeah, good. And that's it. You know, it's a lot. We've had a lot tonight, but
I didn't comment on your other bit, but I'm glad you feel like you're getting acclimated and feeling like it's working. That's great.
Yeah.
You're doing good work.
thank you.
Yeah, I agree with that. I feel like Somerville, we have a lot of different topics and challenging ones, so you've done great.
Thanks, Paula and team. I would have to just say the team that I have inherited and that I am forming are fantastic, and they are so much fun to work with and great energy. So I'm really lucky. And that the city invested in some of these newer positions and really values public health and the work we're doing. So thank you. It's great to be here, but I, you know, can't do it. They're really the superstars.
It's a separate topic that we probably shouldn't get into tonight, but you had, or a related separate piece, you were talking about some of the metrics that you wanted to provide and give us data. And there's one thing I feel like I've developed an expertise in my medical career. It's using performance metrics and outcome metrics in a medical context. And I'm a bit of a crank on this one, but I am deeply a believer that you can use performance metrics, you can use outcome metrics to improve performance or to evaluate, but you can't do both. If you're using it to evaluate people or programs, then you're not going to make improvement. And if you're making improvement, then you have to separate out the evaluation of people. And so when you talk about combining budgets with this, it makes me very worried. The classic example of this, sort of the first set of metrics in healthcare that they tried to do was to, in New York City, publish the survival rate of cardiac surgeons, basically. So you could see which surgeons had the best survival rates of a given cardiac surgery. And what they found was that a whole lot of surgeons stopped doing procedures on high-risk individuals.
Right.
So sure, their percentages look really good, and you could say, oh, that person has a 97% survival rate of their procedure. But if they're taking people who didn't need the procedure in the first place, it doesn't really tell you. So it's just very dangerous to use these metrics without thinking about the broader context. So I would love to spend time helping think about what we are going to work on improving versus what we're going to use for budgetary purposes.
Great. So by budgetary purposes, I meant more what support financially would we need as a department? I don't mean, you know, like any one individual or anything as a performance thing.
Incentives. I know you're not talking about incentives, but these things are not easy to keep separate.
Okay, gotcha. Yes, right. So it all kind of stems from what are our overarching goals? How will we know as a team that we've been successful or moving in the right direction without penalizing, putting wrong incentives? I see what you're saying. Yeah.
So anyway,
yeah.
for another time.
Okay, good point.
And on our agenda, the only other thing I see is next meeting.
Mm-hmm.
February 16th. It's okay by me. Robert, you look puzzled. No, you're
Yes,
good.
I was pulling up my calendar and it's good.
Okay.
Yeah.
He can actually pull up a calendar while he's on a Zoom, unlike me, who was
Oh,
not
I was
able
gonna
to
say,
do that.
I realized I'm not a computer guy other than that I have to work on 3 different computers all day. But my theory now is the reason why I see things that you don't is because your screen is set so that the margins are outside. So what we see
Yeah.
when GoToMeeting's presenting your screen is larger than the margins of what your monitor is putting out.
I think so too.
So
Yeah,
I think
so I
you have to
wonder
go into settings for
if I
your
can
monitor.
change the setting. Yeah, that's exactly it. It's like going, there's nothing beyond the,
Yeah.
I mean, I can't even get on the screen if that makes you feel better.
thanks,
I
Paula.
mean, I think I have to put a little bit more effort every meeting. I'm like, I'm gonna get on. I'm gonna figure it out. I think I have to like delete the app and download it again and start from scratch because I've gone in my settings, both this and my phone settings, and there's no option to go on the screen. So I think I'm gonna try that.
Are you on a phone or a laptop?
I am on a phone, but I've been able to
Yeah,
get
you
on the
should
screen
be
before.
able to. Well, maybe we'll practice
Yeah,
next
yeah.
time.
And
Okay.
we talked about meeting in person in the spring, so
Mhm.
Yeah.
maybe we'll
Yeah.
do that.
My
Okay.
Yeah.
computer I don't have a Mac, and my computer, it's just like a Microsoft or whatever, and it's not compatible for this for some reason. So that's why I use my phone.
All right. Well, if nobody has any other Board of Health agenda items, then I propose at 7:19 we adjourn.
I second it. Have a good month, guys.
Yeah,
Take
happy
care,
Valentine's
everybody.
Day before we meet again.
Yes, I know. Yes.
Time
Take
just
care,
keeps flying
everybody.
by.
Thank you.
Bye. Take care.
Bye.